Choledochal cyst. Hi, I'm Dr. Kant Shah, Pediatric Robotic and Laparoscopic Surgeon, and today we will talk about what is choledochal cyst, what are the latest treatment options, and what is the long-term life and outcome like. So, a choledochal cyst is nothing but a widening or a dilatation in scientific language of the main bile duct or the pipe through which the liver drains the bile into the intestine. Such a widening starts usually at birth or soon after birth, and it may either grow to a large size immediately and produce pain or jaundice, or have intermittent symptoms of pain and jaundice throughout the child's life or into adulthood as well. Some children may have pale stools because the bile doesn't flow adequately into the intestine and the bile gives yellow greenish color to the stools. Unfortunately, some children present with cholangitis, which is a serious infection of this bile within the bile duct. And sometimes such a widening may be incidentally found on a routine scan. So how do we diagnose a choledochal cyst? The first step is an ultrasound scan where the liver and its ducts are always seen, and if there is any widening, it is reported by the radiologist. If there is widening, then the child would need to consult a pediatric surgeon who would determine the significance and the seriousness of this widening, and to confirm this, usually an MRI scan, a specialized MRI scan called an MRCP is done. The MRCP not just looks at the bile duct but also the condition of the liver, how are the ducts inside the liver, and also where the bile duct joins the pancreas, is there any problem over there. Subsequently, if the child has symptoms, also some blood tests would be done which are called liver function tests, and this would tell us the level of jaundice, the level of blockage of the bile, and maybe if it is affecting the pancreas also. Sometimes a slow flow of bile may actually block the pancreatic duct or the pancreatic pipe also, causing pancreatitis, which is also a very serious life condition. In all such cases of choledochal cyst, a pediatric surgeon's opinion is must. Most of the pediatric surgeons deal with hepatobiliary or liver related problems in children. However, some centers are specialized in this. The main treatment of this condition is to remove these bile ducts because they are abnormal. They will keep on widening, they will keep on causing problems, and eventually they may even undergo cancerous changes. So all such bile ducts have to be removed and a loop of intestine has to be joined to the liver so that there is a free flow of bile. Traditionally, this surgery would be done by a very major open surgery, but for the past few years, we have now been doing it by laparoscopy or robotic, eliminating completely the need for any major cuts in the child's body. Such laparoscopic or robotic surgery can even be done in a few months old baby. Such a surgery has excellent outcomes as comparable to the open surgery and much faster recovery in the long term. Children after this major surgery may undergo episodes of cholangitis or blockage of the bile flow. This risk is reduced by doing more accurate surgery by using more precision techniques by laparoscopy or robotic, where the magnification is more than 30 to 40 times. Such a surgery usually takes 3 to 5 hours, after which the child would stay in hospital for 5 to 7 days until the bile flow is well established and the child is able to eat and drink normally. The child would need some blood tests as a follow-up, and the parents would be taught to monitor the color of the stool of the baby. Feeding the baby usually starts within a day or two after surgery, and most children would make a healthy recovery within 1 or 2 weeks after this very major surgery. Regular follow-ups are required for a few years, which involve mostly ultrasound scans and some blood tests like the liver function test. Most children would have a completely normal life after this major surgery. To give an example, we had a child who was 5 years old girl from Amravati district in Vidarbha of Maharashtra, where she started having the symptoms almost within the first year of life. However, she was treated by a doctor with medications for almost 3 years, and by the time she reached us, she had many episodes of cholangitis. This made the surgery very difficult because every episode of cholangitis causes a lot of fibrosis in that area, which makes the surgery and removal of this bile duct difficult. However, she underwent robotic surgery and made a completely healthy recovery within 8 days, and today after many years, she is leading a healthy normal life and goes to school every day. So, laparoscopic and robotic surgery is the ideal treatment for choledochal cyst, and such a major surgery can have very good long-term outcomes in children if this condition is dealt with in time. If you have more questions or comments about this condition, then please do write them down in the comment section, and please like and subscribe our channel. Thank you.